Welcome back. Many preteens may be unprepared for changes that come with puberty. A new national poll says about 40% of parents talk to their kids about it only after their child brought it up. Why experts say the conversation should happen sooner. Plus, smoking rates are drastically declining. And a different type of blood test could more accurately predict the risk of heart disease. Those stories and more in tonight's Health Watch. It can be a tough topic, but doctors say preparing children for puberty is important, and hearing about it from parents, not just peers, makes a huge difference. Anticipatory guidance, or letting their kids know what to expect, not only keeps them informed, but can reduce anxiety, especially because puberty is starting earlier and earlier. Doctors say parents can start by asking open-ended questions about your child's understanding of puberty and the physical and emotional changes that will happen to their bodies. They encourage parents to answer questions and normalize the experience because it's something everyone goes through as they become an adult. Young adults are driving a dramatic decrease in smoking. University of California, San Diego researchers found states with historically high smoking rates have seen the biggest declines. But the progress is not as fast for adults over 50, which could delay reductions in smoking-related diseases and deaths. Researchers project the national smoking rate will be less than 5% by the year 2035, compared to around 57% in 1955. Research out of Sweden and Harvard University finds a simple blood test measuring two lipoprotein markers can give more accurate information about the risk of heart disease compared to cholesterol levels. Lipoproteins carry cholesterol and other fats through the blood. Researchers say in about 1 in 12 patients, standard cholesterol tests may underestimate the risk of heart disease. And a new global study links consuming ultra-processed foods with preventable premature deaths. It shows in countries like the U.S. where consumption is high, the foods cause as many as 14% of premature deaths. Researchers are calling for revised dietary guidelines and public policies. And this isn't the first study to yield these results. Research out of Australia also found higher intake of ultra-processed foods could increase the risk of anxiety, obesity, sleep disorders, and the development of type 2 diabetes, as well as the risk of depression. For a closer look, go to the features section of our website, 2news.com, and click on the Health Watch icon.